so frozen shoulder usually happens after a trauma, and the person goes into what's known as broken wing position, which is elevation and internal rotation. And they do that to protect the compromised joint. And one of the things that will happen during that time when they're protecting is some of the muscles that control this movement seize up. So subscapularis underneath the shoulder blade, pec minor, sometimes pec major, and even the bicep will be affected from being in this shortened position. So usually after the initial injury has healed or been taken care of through surgery or whatever else, the person is left with these muscles that are so seized up and non-functional that it leaves the shoulder in kind of a frozen state where range of motion has been compromised. So the way that we begin to get a person to overcome that frozen shoulder position is to take them back to how the shoulder developed in the first place, which is usually on the floor. So when we're born, we don't have cervical or lumbar curvatures, and someone puts us on the floor, and this is how we start developing those curvatures. So usually an infant, when they're first put on the floor, can barely even hold their head up. And as they do this over the course of a few months, most infants can hold their heads up longer than most adults. This development of the cervical and thoracic curvatures helps the shoulder initially be in the right place. And then, as the infant continues on, he begins to push himself up off of the floor. This is the beginning of the development of the rotator cuff. And it's happening in concert with the development of the cervical and the thoracic spine. So usually when I have someone who has a frozen shoulder position or frozen shoulder, I'll have them start just with light pressure pushing up off of the floor to whatever degree that they can tolerate. And as they get stronger and better range of motion, we continue on. And they can even go to a position where they're putting more weight on one shoulder than the other. Eventually, we go into more of the 4-point position. And, as the infant gets into this position, they don't just start crawling. They'll usually start rocking first, which going through these different ranges with a little bit of pressure can also help the shoulder joint work through some of those stuck positions. We can even then progress to the dynamic horse stance, which is going through the full range of motion again, full extension all the way up and all the way down with breathing. Or we can go to a shoulder rotation, where the person is rotating, inhaling all the way, and then exhaling all the way down. Now, of course, this has to be done as the person can tolerate it without any pain. You should never push through pain, especially when you're rehabbing a joint. Those are the beginning stages, usually, for getting the person out of that frozen shoulder position. The reason why the floor is so important is that to your brain, neurologically, that is a safe position. Open chain positions with cables and bands don't usually feel as safe for the joint. And so it can take much longer for the person to break free of that frozen shoulder position with open chain movements. Okay, that's it.